Hello, my name's Tim Germon and I'm a spinal neurosurgeon. Welcome to the second talk in a series where I have examined the current management of spinal pain. In the first talk, I demonstrated that the fundamental principle of making a diagnosis is being ignored, and this is leading to irrational and ineffective practice. Now, although I'm based in the UK, most guidance employed by most countries is all very similar. In this talk, I'm going to explore why this behaviour might have arisen. In fact, the medical establishment has a long history of adhering to ideas, even in the light of overwhelming evidence that established practice is found wanting. This is Jon Snow. His description of identifying the Broad Street pump as the source of a cholera outbreak and thus confirming the spread of cholera by water is famous, and yet it took 11 years for his observations to be recognised and definitively acted upon. This is because the establishment view was that disease was spread by a miasma of bad air. This is Helicobacter pylori, the cause of an epidemic of peptic ulceration which was experienced in the 20th century. It was actually identified in the gut of mammals in the 19th century, but further investigation was stifled by the surgical establishment and insistence that gastric acid overproduction was the cause of peptic ulceration. There was massive investment in the development of antacid medications and mutilating surgery. Treatments which were continued for years after definitive proof that the Helicobacter was indeed the cause and that the treatment was antibiotics. The ability to continue believing something to be true in the face of overwhelming evidence to the contrary is not particular to medicine. It's a common human characteristic. This is Pythagoras, who founded the Pythagorean Brotherhood in the 6th century BC. This is Aristarchus, one of the last of the Pythagorean Brotherhood, who lived in the 3rd century BC. He had worked out the heliocentric nature of the solar system. As a result of Plato's decree that all heavenly bodies were perfect spheres and moved in perfect circles, and that the earth was at the centre of the universe, being adopted by Christianity, Aristarchus' theory was rejected, and scientific effort for the next 1500 years was spent trying to explain the observed motion of the planets in these terms. It wasn't until, somewhat paradoxically, a monk called Copernicus, using ancient Greek data, rediscovered that the sun was indeed at the centre of the universe. This is Hans Christian Andersen, famous for his story of the Emperor's New Clothes. This story probably originated in Persia and migrated to Greece to be included in Aesop's fables, and was then introduced to Spain by the Moors. Andersen came across a German translation of a 15th century Spanish version. The story is about holding a belief in the presence of overwhelming evidence that it cannot be true. It is interesting to speculate what particular belief the original story was challenging. Was it a subversive challenge to some form of government, monarchy, or religious truth? Whatever it may have been, its age tells us how old this aspect of human behaviour is. Paine was an Englishman who spent a lifetime challenging the establishment and is famous for writing The Rights of Man and The Age of Reason. He had insight into what it's like to challenge the prevailing establishment ideology. In 1776, he wrote this, Common Sense. It's addressed to the inhabitants of North America, explaining to them why they should be a republic separate from Britain. In the first paragraph, he demonstrates insight into the difficulties of the task he set himself. Firstly, he knows people are capable of believing things they are told without question. A long habit of not thinking a thing wrong gives it the superficial appearance of being right. He also has insight into the potential consequences he might be inviting upon himself, and raises at first a formidable outcry in defence of custom. But the tumult soon subsides. Time makes more converts than reason. In fact, this statement is optimistic in that he was well aware from previous experience that challenging established ideas usually provokes a hostile response. People holding a view which is being challenged, but which they cannot constructively argue against, often resort to personal, so-called ad hominem attacks. Paine was well aware of this as a consequence of his support for the French Revolution, when his life had been threatened and his effigy had been shot, hung, burnt, and in other ways disfigured. The cause of an angry response is probably twofold: pride and vested interest. None of us like being told that we're wrong. However, I'm sure we've all indulged in practices or beliefs without question, because we've been told to do so by some form of authority. It's embarrassing to realise that perhaps we should have been more sceptical. Secondly, if holding a certain belief is central to how you earn a living or gain some other form of reward, a challenge to that belief will be perceived as a threat. Interestingly, in the realm of psychology, this ability to hold a belief in the face of counter-evidence is well recognised, and functional MRI studies have suggested that this behaviour relates to changes in those parts of our brain concerned with emotion, shown here in yellow and red, rather than reason. In fact, I think the problem of vested interest in medicine is much greater than it first appears. Interests include industry, the National Health Service, a particular problem here in the UK, the academic press, professional societies and other interest groups, as well as individual egos. For example, the treatment of back pain without a diagnosis has a whole industry associated with it, which includes various therapies, injections, denovations and surgical implants. In the UK, the NHS and its various quangos, often in association with professional societies, have produced many documents which support the principle of treating people without a diagnosis. If these documents are questioned, then the government, the Department of Health, the professional societies and the individuals who have contributed can possibly lose face. Unfortunately, it's no good depending on an impartial scientific literature. All the prominent journals have supported the principle of treating back pain without a diagnosis. For example, in 2018, The Lancet published an editorial along with 3 articles in support of the concept. Although it prides itself on setting extremely high standards and selecting only the best papers for their quality and progression they bring, this claim is hard to reconcile with a paper published in 2011 supporting the idea that you should treat people complaining of pain based on a 10-point symptom severity score and that diagnosis was not required. If this were true, there would be no point in diagnosing anything. We could treat everything with some cognitive behavioural therapy and physiotherapy, based on symptom severity scores. Now, I should make you aware at this point that I do have a vested interest of my own in making a diagnosis, because I believe that you can only perform surgery, or at least discuss the risks and benefits of surgery, if the diagnosis is clear. So, a journal can claim to be impartial as a consequence of its review process, but if the editor chooses not to send your paper for review, there's nothing you can do. So, are the editors of The Lancet really going to publish something that seriously questions their judgment in what they've published over many previous years? So I hope I've at least planted a seed of doubt in your mind about how rational our current practice of medicine might be. It may not be as rational as you might have hoped. I've shown you that the irrationality is actually normal for human society. I've also shown that having personal insight into this might lead to uncomfortable consequences for you. This quote from George Orwell describes what it is to tell the emperor that he has no clothes. During times of universal deceit, telling the truth becomes a revolutionary act. Now, it's actually a shame that there's no evidence George Orwell actually said this, but if you've read any of his books, I'm sure you can imagine that it's the sort of thing he could well have said. Finally, if you find yourself in the position of questioning what you are told by higher authorities and revolutionary thoughts are entering your head, you could be diagnosed with compulsive thinking. In these circumstances, brain stapling is a rational intervention which you may consider in order to make your life easier.